Hi, my name is John. Today I'm going to talk to you about an 87-year-old male hospitalized with chest tightness and dyspnea. Very first thing that you want to do in every EKG is to look at the rate. If you can go ahead and look at lead 2, you start off here, that's 300, 150, 100, 75, 60, and 50. So the rate is between 50 and 60. Placing the patient, you consider this patient bradycardic. Next thing you want to do is look at, is it normal sinus rhythm? You can appreciate you look for a P for every QRS and a QRS for a P. So here, you might not be able to appreciate a little bit of P, but you can definitely see the QRS complexes, and they're evenly spaced out, right? Which makes it sinus rhythm. Another thing is that after that, then you just go ahead and just scan the EKG looking for any abnormalities, and you do appreciate some right bundle branch block on V1 and V2. Some things to consider with right bundle branch block, and I'll go here in this next slide, is that one of the things that you find are widened QRS complexes. And that can be appreciated here in V1. You can look at, and if it's greater than 0.12 seconds, or you look and if it's greater than 3 small boxes, then you definitely have a widened QRS. Those are one of the criteria for a right bundle branch block. The second thing to look for is that the secondary R wave in V1 is usually taller than the R wave, the primary R wave, and that's the case here in V1. You can see that. Here's the secondary R wave taller than the first R wave, and you can see in the next slide a better look at it. You can see that the secondary R wave in lead V1 is usually taller than the initial R wave. That's another thing that you can find in a right bundle branch block. So to continue with this patient, you see that there's a V1, V2, there's a right bundle branch block. So that's one of the things that you see. Another thing that you see here is here in leads 3 and AVF, you can see some Q waves. These Q waves, these inferior Q, indicate maybe an acute or recent inferior MI, that being in leads 3 and AVF. Also in V1 and V2, you also appreciate some Q waves here. And that can also indicate an anteroseptal, so V1, 2, 3, and 4 are considered anterior. So here it indicates some anteroseptal Q waves.